Welcome back to Lab Talk. It's the podcast where we explore the stories, leadership, and innovations shaping today's laboratory medicine. I'm your host, Irina Ashman, laboratory recruiter, and your guide into the clinical laboratory world. Today, I have a very special guest, Dr. Durrani, who is the Director of Clinical Laboratory Services with New York City Health and Hospitals, and I'm super thrilled to have you on the podcast today.
Thank you, Irina.
I'd like to talk about innovations in the world of point of care testing, especially the new technologies that are changing diagnostics in real time. So I'll walk you through a few categories and we'll dive into it and explore, and then you let us know your thoughts. So the first one is rapid molecular tests. They deliver results in under 15 minutes for COVID, flu, RSVs. What's your take on this? Is it really that fast?
Yeah, this rapid molecular testing, you are right. Uh, Usually from 15 minutes to 45 minutes or maximum 1 hour depends on methodology and the manufacturer you are using. Different people have different timing. But as far as their accuracy and effectiveness is concerned, it has its value, and it's rapid, it's in a timely manner, and it provides a nice opportunity for the clinician to be nearby the patient side. So before go into further detail, I would like just have a small glimpse of what point of care testing is for most of the viewer who don't know. So
Mm-hmm.
point of care testing is basically the testing that is performed outside the laboratory by clinicians near the patient side, whether it is a hospital unit or a private clinic or an ambulatory urgent center, whatever the setting may be, but that has been approved for point of care testing at the patient side. What happens? The clinician see the patient based on the clinical history. They collect the specimen and
Mm-hmm.
perform a rapid test. The patient don't have to wait for hours,
Mm-hmm.
maybe more days when it goes to the lab. And those molecular testing, they have been so simplified and made it easy because you have to get through an FDA approval. And FDA approval is granted like the most simple test, the less number of steps involved in testing is better for their testing. So if you go to and compare it with the laboratory testing, laboratory, those are mostly like high throughput and it needs batching. You have to do a lot of tests, but these tests have specifically been developed for individual testing. So
Yeah.
one test on one patient at a time. So it ensure accuracy, like you do the right patient. There is
Mm-hmm.
no chances of contamination to report a false positive because in one chamber, in one cartridge and one patient, and when the only thing is like changing the gloves or other PPEs, like if you are using disposable PPEs, so that have
Mm-hmm.
to be changed. Other than that, I like it. It's better for the patient care, and you provide the results right away.
Yeah, it sounds like it's something like an at-home almost a test that can be done because it sounds so simple and it doesn't need the complicated procedures that you do actually in the lab.
Yeah, so with home, there are certain tests they have been developed, like not even requiring an instrument. It's
Mm-hmm.
just like a cartridge base. You put
Oh,
everything in a cartridge, and that cartridge, the even the result window is there. You can read the results. So, and it has come from a long way. Before it was like you are doing manual testing, and
mm-hmm.
now it's more robust. You are doing on an instrument, so much more accuracy. Uh,
The second one I wanted to talk about is CRISP-based diagnostics. So a lot of specialized lab techs know this sort of testing as gene editing, but now it looks like CRISP is being used for fast and extremely accurate diagnostic tests. Is that true?
It's true in the sense like if you go into the development of this test, so initially it was used like for gene editing,
Mm-hmm.
looking for specific DNA and RNA sequencing,
Uh-huh.
and if we look into the nature, anything developed, it exists in nature. So this phenomena was existing in bacteria, where
Mm-hmm.
it was a naturally occurring system uh, to be used like a immune defense mechanism against virus. So scientists work on it and took that idea and how we can use that because it's like DNA and RNA sequence. If you use it so for various testing in a timely manner, and even like as compared to other molecular testing, this
Mm-hmm.
may be done in a minute, and you can do it at
That's in,
home. So
that's just incredible.
yeah, and it's like a breaking through thing, but it's still in developmental stages and initial stages. So I'm not going to go in more detail what kind
Mm-hmm.
of proteins are involved, how this mechanism work. But for the time being, it will be a great step. Like and even it will be much more easier, like even home based testing at the point.
Interesting. So we'll wait and see what happens sometime down the line. All right, so let's move on to the next question. It's the wearable lab-on patch technology. So these are tiny adhesive patches that continuously monitor biomarkers, things like cardiac stress markers, kidney function indicators, and metabolic changes. And what's more impressive is they can actually stream real-time data directly to clinicians. What do you think about that?
So this is another breakthrough, and I would say another like a timely monitoring system and testing,
Hmm.
uh, and not only performed at the laboratory levels or at the clinics level. This is something you give it to the patient. The patient use it at home, and it can be like a 24/7 monitoring, and the good thing is it could be non-invasive or minimally invasive
Uh-huh.
because some patches might need a little tiny needles, and there are basically four primary fluids like blood, saliva, interstitial fluid, and sweat.
Uh-huh.
So these four different fluids and sweat you can easily use for monitoring all electrolytes and electrolytes,
Hmm.
especially those five important electrolytes like sodium, potassium, magnesium, calcium. So
Wow.
any patient having all those deficiencies, kind of diseases, and especially like cystic fibrosis, which is a
Hmm.
genetic disorder, and mostly
Hmm.
what happens like for that you require sweat uh, testing. So chloride is basically tested, and now you are testing that in a timely manner, like and the good thing about this data is directly going to either a device, and it's totally like through a Wi-Fi system.
Hmm.
It does not need some sort of like connection, so you can have it to your uh, tablet, to your smartphone, to your computer. Your clinician can get the data.
Interesting. That's
Yeah.
actually my next question because I wanted to follow up. So the smart connected device and data integration testing, I would assume that this is considered to be one of them because it basically can send updates to your clinician's phone or public health database, or the results can be sent to EMRs. So it feels like it's bridging a gap in communication and in a very timely manner, right?
So before we go to your that question, so let me quickly finish that. Like we just talked about sweat. So the
Hmm.
saliva you use for hormones, different hormone monitoring like cortisol, um, sex hormones, so that you can get data in a timely manner.
Hmm.
Uh, interstitial fluids, you can have like lactic acid. So especially when the athletes when they are running, right, in a timely manner they can monitor their dehydration and lactic acid, and lactate is not only like you start strenuous exercise, so it will go high, but it provides like an average kind of thing to your clinician, so they
Hmm.
would know like that sudden spike was not because of any abnormality. It was because of that strenuous exercise, or if a patient is in a steady state, or if there is some kind of sepsis. So these things will be monitored in a timely manner. So
Hmm.
that's for that. And for blood, like you mentioned in your questions, like different biomarkers, kidney biomarkers, where these dialysis patients, they can monitor their BUN, creatinine. For heart, you can monitor your troponin level. So these are all kind of things like in a timely manner. It can alert the patient, and it can alert physician as well.
Hmm.
Similarly, glucose monitoring, and it's very famous and everywhere available. All these diabetic patients now, they have those patches attached to their arms or anywhere, and
Hmm.
it continuously monitor. And when it goes down to the critical level, it alarms you, or if it is higher level, it also alarms you. So that's the time like you have to take intervention, whether you need to reduce your glucose level or increase
Hmm.
your glucose level. So
Yeah,
it's
I mean, that's smart connectivity and and its quality management and, error reduction, everything. I feel like this is another breakthrough that will be widely used in point of care. Let's go back to the smart connected devices, the ones that are able to stream the data directly to your clinicians. The results can be sent to the EMRs. How long has this been used for? When was it implemented?
so I think it has a history, and I would say for more than a decade. Uh,
Mm.
or maybe more if you go further, like when these glucometers were used
Uh-huh.
initially, and other all point of care testing, they were like manually performed, like urine pregnancy, urine analysis, HIV testing still
Mhm.
manually performed. Uh, but with the advent of these instruments and technology, and especially when this COVID happened, it changed a lot of everything. But
Mhm.
before COVID, it was, if I recall, like somewhere to before 2012, still those interfacing ability of the point of care instruments were available to these tests when they are performed on sites. So they had the capability to either integrate these systems to a laboratory information system, which is
Interesting.
mostly used in laboratory, or to the patient EMR directly. So and that was like I would say integrating these testing results into those medical device interfacing. That was like something which because point of care, it was initially blamed for errors, like it's not error free. But now with these things, when the nurses or the technician or the providers, when they go to the patient, they scan their specimen barcode. And even now nowadays QR codes are available which transcribe all the
Mhm.
information, and by the moment the test is performed, it directly goes to the patient EMR, and patient, although there are certain tests which may require, like if the provider is not performing
Mhm.
and someone else is performing their test, and some sort of interventions are required. So that has to be, and those are also canned comments.
Mhm.
Now it's not like you are typing something uh, on those keyboards, like I remember when we were defining those comments. So we were giving them like mnemonics. Nurse, hey, if you see critical, so look for C on the keyboard. So
Mhm.
you press that C, it will automatically bring you the canned comments like critical value, provider notified, whatever. So
Uh-huh.
those are also like sort of. So in nutshell, I will say like integrating these instruments, and every instrument has the capability. And it's not only like you are using those old Ethernets. No, it's through Wi-Fi and other, and in point of care they have docking system. When you dock the instrument, the results will automatically go. And in some instances, most of the manufacturer, they have now Wi-Fi, or some they provide both Wi-Fi and
Hmm. Yeah, so this has been already actively used in the lab. Good to know because for some reason I thought that this was something new.
but new things are coming. Like before, it was very few instruments. Like
Hmm.
pregnancy testing was done manually, and then instruments came. Uh, Urine analysis, they will be doing those dipstick. In most areas, still they are doing
Hmm.
when where they don't have these luxury to have those instruments who can do the urine analysis for you and automatically transcribe.
Hmm.
So they still, when they do that manual, then they go there, either scan it to the patient chart or
Right,
put it. So still those practices are there, but
right.
uh, since long, I mean, when I started point of care in 2012, I
Hmm.
know these interface and those capabilities,
Hmm.
and there were data systems with the delta checks, which provide you uh, a chance to review. And previously you had a patient, and if you put the same MRN, so it will come to you like, hey, this patient was previously positive, and no, it's
Mm,
negative. So that's the time you it provide you chance to review your results and speak to
mhm.
the provider.
That makes sense. Okay. Well, thanks for answering. And let's move on to another one, which is an interesting one. It's a multiplex testing, and it detects multiple pathogens from a single swab. So a clinician can now run one test and check for COVID, flu, RSVs, strep, and more. So it's faster for patients, more efficient for clinics, and it actually improves accuracy tremendously, right?
Yeah. So multiplex testing, I don't know if I mentioned earlier, like aside from all these advantages of point of care,
Yeah.
the biggest concern about them was cost of testing,
Hmm.
because point of care was usually uh, considered like very I mean like costly as compared to laboratory test,
Hmm.
and it was true in a sense, because a CBC test performed in the laboratory, it may be $1 or less than $1, and if you are doing it in point of care location with those specific instrument, it may be $3, $4, $5.
Hmm.
Same if you are doing CMP or other tests, it will cost you more as compared to laboratory.
Hmm.
Now, these vendors and these scientists, they say, hey, how can we make this possible? So, and also, it was the demand of the time. Like a patient come with symptoms, flu-like symptoms, and you did a test on it, and it's not flu. So
Hmm.
what you are looking for? It could be COVID. It could be anything else.
Yeah.
Uh, so that keeping in view all those things, they came up with a test, like say before, when this COVID started, it was COVID alone. The cartridge was say in between $50 to $70. Now with that one, you can do COVID, flu A, flu B, RSV with this multiplex testing, the same cost, the same time, the
Yeah.
same specimen. So it saves a lot. And if you go into more further detail, the cost may become a little bit high, but especially in pediatric subjects, right?
Hmm.
Any flu symptom is important. Any symptomatic patient. So you cannot take chances because of their low immunity as compared to adult. So it
Hmm.
may not be COVID, it may not be flu, it may not be RSV, but it may be something else. So they came with like,
For pediatric patients, I feel like this is such a big change. because just being a mom of three and I know how hard it is when your child is sick and you take them to emergency room and if they can detect it right away, it's a win for everyone, right?
Yeah. So that multiplex testing provide you a chance, like no, there are panels, 20 to 33 pathogens.
Mm-hmm.
So if it is not flu or RSV, COVID, so what is it? It could be adenovirus, it could be a
Mm-hmm.
rhinovirus. So all those kind of things is provided with that this multiplex testing. Uh,
Mm-hmm.
Similarly, like the advantage of point of care testing, like you did talk about strep group A. So strep group A testing also with the multiplex or without, like if a patient comes and you do antigen test, so what happens if it is negative? All these assays have been approved by the FDA, like it has to be with reflects to traditional culture.
Mm-hmm.
So that's for the, but if you are using rapid test at the point of care level for this group strip A, so you right away, you know there whether it is positive or negative. So if it is positive, you start the treatment right away. If it is
Mm-hmm.
negative, you don't care, you do symptomatic treatment. And you are done at that point. But in case of culture, then you have to wait for um, um, maybe 24 hours, 72 hours when you get the
Mm-hmm.
results. And then once those results come, and then the clinician have to do intervention, whether if the patient was put on antibiotic first, so then they will have to recall the patient and say, hey, you don't have strep A. And if they
Uh-huh.
haven't put, so then they will have to call and prescribe the medicine. So they know what they are doing, but like if why not at the doorstep, if you are having something and you make your decision right away there,
Oh, of course.
based on the laboratory diagnosis, confirm rather you are taking into consideration
It
patient
makes a
history and
huge difference in patient care,
yeah.
huge, and especially in kids. Because
Yeah.
I remember, yeah, my son is 9 right now, and I remember um, in his first year, we did go to the doctor, and we did actually have to wait, I think, 72 hours until they got back to us, and that was a challenge because we weren't sure what was going on and little anxious about what it actually was. But I mean, now things are changing and for the better. So that's amazing. Well, thank you so much for sharing your expertise today and your insights into those innovations are very, very useful. And I really appreciate having you on the podcast today, Dr. Durrani.
Thank you. Same.